This episode of Fertile Talks is sponsored by ILMeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ILMeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Good afternoon, everyone. This is your host, Dr. Yemi Famuyiwa, and welcome back to another episode of Fertile Talks. So today we're going to be tackling a topic that's little talked about, and that has to do with stress and fertility in men, right? And the foundation of this episode actually came from a study that was done in China using almost, I believe, 400 subjects, where they looked at the effect of stress and mindfulness in controlling their fertility outcomes. They looked at the fertility quality of life in this men as well. So we all know infertility is a global issue right now. It's a global problem. In fact, the World Health Organization says it's now 1 in 6 couples who can't conceive. It used to be 1 in 8. And we know that these issues could be male-related, female-related, or a combination of the two. So while physical causes of male fertility, such as genital urinary infections, chromosomal abnormalities, and hormonal imbalances have been well studied, I think the role of stress and mental health in reproductive health is still an emerging field of interest. So in this episode, we're going to explore the profound impact of stress on male infertility. Specifically, we're going to look at the role of mindfulness in improving fertility-related quality of life and how social support can be a game changer in fertility treatments. So let's understand the link between stress and male fertility. Infertility can be a silent struggle, right? Especially for men who often experience stigma and pressure related to fertility. And studies have shown that infertility is not just a medical condition, but also it has a significant emotional burden that can impact the physical health, self-esteem, and relationships. So let's talk about fertility stress. Infertile men often experience stress from multiple sources, including social networks, marital relationships, personal expectations, right? And studies suggest that this type of stress can have a direct negative effect on sperm quality and overall reproductive health. The- on, it also has an impact on semen quality. So high levels of psychological stress has been linked to lower sperm count, lower motility, and lower morphology, which is the shape of the sperm. Chronic stress triggers the release of cortisol, which interferes with testosterone production and sperm development. Infertility related stress often leads also to depression, anxiety, and strained relationships. So there are social and emotional consequences. And this affects the quality of life and even diminishing interest in intimacy. So let's look at what is the role of mindfulness in fertility and how can mindfulness help? So mindfulness is a practice that emphasizes being fully present in the moment without judgment, like fully tuned in, like I'm tuned in to you, you're tuned in to me, being totally mindful of that. Studies indicate that men who practice mindfulness report lower levels of anxiety, higher emotional resilience, and a better quality of life. So there are something called MBSRs. They're called mindfulness based stress reduction programs. These programs incorporate mindfulness techniques and they've shown some promising results in reducing fertility related distress. Right? There are also self-regulation and coping mechanisms that can help. So mindfulness helps individuals process emotions in a healthy way, right? In a healthy manner. And it reduces the intensity of negative emotions associated with infertility. So they have been shown to improve fertility treatment experience. Men who engage in mindfulness practices are more likely to adhere to treatment plans. They have they maintain better communication with their partners and experience higher satisfaction with medical care. So let's talk about social support and fertility. Let's talk about breaking the silence. One of the most crucial but often overlooked factors in fertility treatment is social support. Why social support matters. Studies have shown that men who receive strong support from partners, family, friends, and even online communities experience lower fertility stress and improved emotional well-being. There are barriers to seeking support, and this can be due to cultural stigmas and traditional views on masculinity, right? Many men hesitate to discuss their infertility struggles. And this can lead to feelings of isolation, shame, and reduced mental health. So, how do you find and build support systems? Number one, partner support. Open and honest communication with your partner can significantly reduce stress. Counseling and therapy, professional counseling, helps infertile men process their emotions and um, develop coping strategies. Support groups and online communities. So joining a fertility support group can provide comfort, shared experience, and valuable resources. So we're going to be introducing a group session for our patients where you can kind of talk um, with, um, with the group. We're going to introduce that. That will be nice to have something to have. So joining a fertility support group can provide comfort, shared experiences, and valuable resources. So what are some practical strategies for reducing fertility-related stress. So practicing mindfulness daily, engage in meditation, deep breathing exercise, or yoga to manage stress. The use of mindfulness apps such as Headspace and Calm to build a daily routine can be helpful. Improve lifestyle choices. Things like maintaining a balanced diet that's rich in antioxidants and omega-3 fatty acids. Exercising regularly, move your body. This helps to boost testosterone and reduce cortisol levels. Ensuring enough sleep, because poor sleep is linked to lower sperm quality. And then seek professional guidance. Work with fertility specialists, therapists, or coaches who understand the unique challenges of male infertility. You can consider things like acupuncture that works for you and other stress reduction therapies as complementary treatments. And then, most importantly, break the silence. Talk about infertility with trusted families, with trusted friends and professionals, and especially individuals that advocate for mental health support, like in fertility clinics. So, final thoughts. Infertility is not just a physical condition, it's an emotional and psychological journey. By addressing stress, incorporating mindfulness practices, and building strong social support networks, men can significantly improve their fertility quality of life and increase their chances of successful treatment outcomes. We hope today's discussion sheds light on the importance of stress management in fertility. And if you found this episode to be valuable, please subscribe, leave a review, and share it with someone who might benefit from it. So join us next time on Fertile Talks for another insightful discussion on optimizing reproductive health. Until then, stay hopeful, stay informed, and take care of your fertility journey. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famiyiwa.